So before I start, I'm going to make sure I grab all of my materials, including my stethoscope and my pen light. I can review the patient's history before I enter. I can also perform hand hygiene outside of the room or inside the room, so I will do that now. Alright. I'm going to knock. Hello, how are you doing today?
Good.
Good. Alright, well, before we get started, can I just verify your name and date of birth?
Jessica Credibil, 21005.
Alright, awesome. Well, nice to meet you, Frankie. My name is Maddie. I'm going to be your student nurse today. I'm just going to do a quick head-to-toe assessment on you. Is that alright?
Yes.
Alright, awesome. So I would provide privacy. I'm going to start with the head. Take a look at my patient. Just a quick, brief assessment. I would take vitals, which includes temperature, respirations, pulse, BP, and O2 sat. Once I have all my vitals, I can begin with the head. So I'm going to check for any bumps, any abnormalities, maybe even any redness, anything abnormal that I might see. I'm going to move on to the neck. I'm not going to palpate here. Again, checking for any lumps. I will also check the carotid. Okay, good. Next, I'm going to move on to a face assessment. I'm going to check the eyes, make sure there's equal dilation. Okay, my sunlight works. There we go. And then, yeah, continue looking straight ahead for me. Perfect. All right, I'm going to move on to the ears. Check in here. I can also look to see if there's any redness, any swelling, anything abnormal I might see here. All right, awesome. Can you look up for me? Check the nose. All right, and then can you open your mouth and say ah? All right, and then I would check the mouth for any wounds, any redness, any swelling. Can you smile? Awesome, all right. All right, so next I'm going to move on to the chest area. So I will listen for heart and lung sounds. I'll start with the heart. All right, checking for normal equal chest rise, normal pulse, normal sounds. So I'll check here. And then next, moving on to lung sounds, making sure there's no wheezing, any abnormal sounds. All right, can you take a couple deep breaths for me? All right, and then I'll move on and do the same thing on the back. All right, just a couple more deep breaths for me here. Good. Good. All right, and last one here. Awesome. All right. Next, I can move on to the arms, kind of checking for any abnormalities there. Squeeze. Can you shrug your shoulders for me? Awesome. All right. Can you squeeze my fingers? All right, awesome. And then I'm going to, can you raise your hands like this? Awesome. Check for equal pulse. Make sure it's strong. Good. All right. And then for this next part of the assessment, can you lay on your back for me? Awesome. All right. Next, I'm going to auscultate the stomach first, and then I'll palpate. Can you just lift up your sweatshirt for me very quickly? Is there any tenderness anywhere? All right. Awesome. Awesome. Next, I'll palpate, just making sure there aren't any lumps. Also doing a skin assessment as well, still making sure there's no redness, any swelling. Awesome. You're all good there. Next, I can move on to the legs. Squeeze here. I can check for pulses. I can do popliteal, pedal, and post-tibial. All good there. Next, I can check for capillary refill here as well, so by squeezing the toes. All right, can you point your toes to your nose for me? All right, and then push down. Awesome, alrighty. All right, you are all good to sit back up. Do you have any questions for me?
Nope.
All right, awesome. Well, you are all good. Thank you, Frankie. I would exit, perform hand hygiene, and chart.